This is Duke University.
What attracts me to this area is that I'm really, it's sort of an ethical and an intellectual investment I've had for 30 years, ever since I was an undergraduate, in really creating traffic between the sciences and the humanities. I think that Holly, I had never thought about this in a historical sense, but the sciences and the humanities, I think that we all lose something when we divide our campuses in the way we do. And I was going to give you the example. I never expected to be a professor in the humanities. When I was an undergraduate major in chemistry, something kind of life-changing happened to me in my junior year. I was taking the classical sequence, which is in physical chemistry, which is first you study classical thermodynamics one semester, and then you do one semester in quantum chemistry, and I loved it. I loved math. I was also at the same time on the other side of campus taking a class in American political philosophy. And we were reading the Federalist Papers and the Anti-Federalist Papers, and we were discussing law, a lot of law. And this idea of natural law came up. And over in my PChem classes, I've been hearing a lot about natural law. The first law of thermodynamics, which I thought was really cool, and the second law of thermodynamics, which I thought was even cooler. And I was like, natural law. So I kind of know about that as a scientist in my American political philosophy class. So what's this idea of natural law coming up in a human social context? And the professor said, I will never forget this, he said, well, that's a rhetorical move. And I thought, ooh, rhetorical move. We don't talk about rhetorical moves in the sciences. So I went back to my chemistry professor. And I said, so we've been talking about the first and second law of thermodynamics. And what do you guys mean when you talk about laws in nature? And he looked at me. We went back and forth and back and forth. And I said, rhetorical move, law, you know, what do you have to say about this rhetorical move thing? Clueless. He was clueless. He said, look, laws, when scientists use the term law, we're talking about a general feature of the universe. It's true here, it's true over there, it's true everywhere. And I said, no, you don't understand the question I'm asking. And so I thought, yeah, I sat down. I was a thinker. I sat down and I said, okay, he didn't get it. I'm going to go talk to the people who really understand words. And so I went to my English professor, who I loved. I had taken a class in medieval English literature with her. And I gave her my whole spiel about natural law here, rhetorical move, second law of thermodynamics. We went back and forth, She didn't understand what I was asking, and I'm sure that I didn't ask I was only a junior. And she finally got exasperated with me. And she said, you know, the scientists are not engaged in interpretation. They tell us the way that the world is. And in the humanities, we're really engaged in interpretive acts with more qualitative texts and stuff like this. And at that point, I said, thank you, and I left, because I knew I'd been involved in laboratory research for 2 years, and I knew she was wrong. Scientists are always engaged in interpretation. Sometimes I wish that humanists were even more scientific in their skepticism about their data. And that was really what started me on the trajectory to becoming a professor in the humanities, was my frustration with the lack of traffic between the sciences and the humanities. It starts at the undergraduate level. It's what attracted me to medically themed humanities. I think it's one of the places where we can generate that kind of traffic, and it's really, it's what I'm doing here. So at this point, I'm going to pick up on something Rebecca said. It is really hard to generate that traffic. The incentive structures in our different disciplines don't reward traffic. Rebecca and I started this medical humanities reading group together, and the physicians and the humanities folks in the group have very different intellectual agendas for this. And that's going to lead me sort of into the discussion here of a couple of the questions that the organizers raised, and one of them is, what is the role, or what could be the role of the humanities in academic programs devoted to medically themed humanities? And this is something I've been thinking about a lot, because over the last year, Rebecca and I have created a new program in medical humanities at WashU at the undergraduate level, and so I've been talking with program directors visiting programs around the country, and I guess I'm a little bit pessimistic. I'm hopeful for the future, but looking backwards, I'm a little bit disturbed by what I've seen about the role of the humanities in these medically themed programs. I see two basic roles in which the humanities have been cast. One is marginalized. A lot of these programs start off, they're founded by historians or by literary scholars, and they, because our focus is, they tend to get eaten up by anthropological and sociological methods, and I suspect it's because our interest is in application in contemporary things. And the humanities is often really not about the present. It's about the past. And so making that bridge has been very difficult. So I see a marginalization happening. And the other thing that I see happening in medically themed humanities programs is that the humanities get instrumentalized. They become tools, especially in medical schools, of giving they're turning physicians into healers, giving them empathy. I don't really know if the humanities can do that, but that's the aspiration. You know, at least you read literature, you get more empathic. And I don't know, I'm skeptical.
That's why our colleagues are saying. I'm kidding.
So observing those two, those two roles into which the humanities have gotten cast so far, at least. I've thought a lot about the two modes within which medically themed humanities can be practiced. And I think one of the modes is the mode that it sounds like the global health humanities is interested in pushing in. So I started off calling it the activist mode. Maybe a more accurate is to call it a healing mode. And the idea there is to approach health, disease, medical care as sort of problems to which humanities faculty can, maybe in a team setting, provide solutions, or might improve outcomes is some of the language that I've heard. So the improving outcomes, it could be in the training of doctors, extending good health to underprivileged communities, which I think is the agenda I'm hearing for global health, global health humanities, and I think that makes a lot of sense. It's a justification, especially to Americans. We're very practical. It makes a lot of sense. I just want to raise the skeptical voice here. Can exposure to the humanities really do that? Are health, disease, and medical care really problems that can be solved? I mean, I think that the humanities is really about raising questions about even that way of framing what we're about, problems and solutions. I don't know. I'm having one of those sort of natural law moments. So I'm just being difficult. Okay, so one mode, and I'm not saying that we shouldn't be doing that. I'm just saying let's think about what's the social project that we're engaged in there. And then the other mode that I think that medically themed humanities can engage in is the scientific mode. Remember, I'm a scientist stuck in a humanities body. I'm claiming that term back from the scientists. I think that the intellectual agenda of the humanities is really to see and understand what was, without judging it, without instrumentalizing it. And that's actually a really difficult project. And I think it's more, so Rebecca, you can jump up and disagree with me. I think it's more the project that we're engaged in with our medical humanities minor. Is more educating on what has been the case or is the case with health, illness, and medicine, rather than with trying to change anything in the world. So I don't think these are incompatible modes, but I think it's important to talk about them. So to answer my first question here about what's the role of the humanities in these new medically themed programs, what could it be? I actually see the humanities having played a relatively small role in these medically themed programs so far, and it may reflect some kind of a tension between the scholarly aspirations of the humanities and the more activist or applied agenda of medically themed humanities. I don't know how to resolve it. It could be a productive tension, but that's what I see at this point. And I may change my mind right by the end of our discussion. Rebecca and I are really in the middle of figuring out, what's going on in this field. Okay, so the second question that our organizers posed for us is the question of what would an ideal collaboration between humanities faculty and global health practitioners look like, and then the allied question, what's the benefit to our students of this collaboration? And I thought I would start off with the second question first and then come back to the first one. So on the potential benefit to our students, when I got invited to this symposium, I was actually teaching a new course that I've developed called Health and Disease in World History. And maybe in the Q&A, I can talk about why I'm teaching that instead of a traditional history of medicine course. The reason I bring it up now is that when I was invited to this symposium, I said I'm going to do some empirical research with my students. So I had about 80 students in my class last fall, and a lot of them want to go into global health. And so I said, well, we were nearing the end of the semester, and so I just asked them, what am I teaching you that you think is going to be useful as you go out into the world and turn yourself into a global health practitioner? And they told me three, I was looking for the overlap in the comments. There's three things that they said. One, and I just want to weep at this, that they had not heard this in other places, that disease is more than biology. It's really that basic. I'm sorry that the humanities are the place where they learn that. Apparently they're not getting that message in any other class unless it's cultural, in the cultural anthropology. Yeah, so they said that it was seeing that in action with people who were already dead. You know, the past is sort of a laboratory. Those people are already dead. You cannot save them. And so you can sit back and kind of think about, well, how does religion affect outcome? How do social structures affect who gets access and who doesn't? I mean, the past is a laboratory for the global health humanities. So that was one thing they said. Right, disease is more than biology. Oh, duh, but that was their insight. The second thing they said, and this hasn't come up, so I may be sticking my foot in my mouth, but I'm going to say it anyway because they told it to me. They said that it was very useful to them in thinking about themselves as future global health practitioners to think about the historical roots of global health with a capital G and capital H in colonial medicine and the history of European imperialism. And in fact, this technocratic language of problem, right, there are problems out there, and they always seem to be in Africa or the Caribbean. That language of problem and solution, it is the language that was invented by physicians involved in the imperial project in the 19th century. And I think that this message really came home to them near the end of the course. We had sort of this running dialogue about what was going on with the Ebola epidemic in West Africa. And I brought in an editorial written by Peter Pio, who was all over the news. Do you guys know who he is? So Peter Pio, he's one of the most prominent global health practitioners in the world today. He's the director of the School of Hygiene and Tropical Medicine in London. And I brought in an editor, which, by the way, was founded at the height of British colonialism in West Africa and India, and it was founded, to create new scientific knowledge, but also to make the empire more governable and more profitable. Physicians and laboratory scientists were very much involved in that. And there was this great moment in the class, and the students generally, the only thing I did was bring in this editorial. The editorial was from Science magazine, and it was called Ebola's Perfect Storm, and it was this very eloquent case for Western scientific and philanthropic agencies to really develop the financial and the political will to develop a vaccine against Ebola and to implement it really fast. It was really eloquent. And I had my students read this, and I said, so forget about what you think about vaccine. You know, vaccine is a good thing, vaccine is not good. Forget about that. What do you see, given everything you've learned in this class, you know, about the dynamics of the town? What do you see going on in this editorial? And there were several students who raised their hand, and what they fixated on was the first paragraph. And the first paragraph was Peter Peel's explanation for why Ebola had gone epidemic in West Africa. And it was a litany of everything that West Africans had done wrong to bring this on themselves. And it was almost, it was the narrative, it was the perfect, almost word for word reproduction of what colonial physicians said when they went to India in the 19th century, when they went to West Africa in the late 19th century. There's West Africans and their crazy burial practices, their inability to get with the program of Western public health, all these kind. And it was, you know, for Peter Peel, this was just the introduction to the case for vaccine. But what my students could hear, I think, better, it was that they were developing that third year. How might that come across to West Africans? Well, and here he is talking from his position at the School of Hygiene and Tropical Medicine, you know, which has that history. Okay, thank you. Good, I'm going to make it. Okay, so that was a very long point number 2. What did my students tell me about how studying the world history of health and disease, how does it help them think about themselves as future global health practitioners? They found it very useful to know about that colonial history. And then third, and this is much more brief, though, there's a world to say about this. The history of medicine, and this, by the way, is why I teach this class, is the history of health and disease and not as the history of medicine. Scientific medicine is really about this important in the history of health and disease. It's a beautiful, I mean, scientific medicine and biomedicine, they are really beautiful productions of the human spirit. They are really powerful, but they, in the past at least, they are not the center of the story. And what my students told me is that it was very useful to see the diversity of healers who were not scientific. It was a reminder to them that as global health folks going out into the world, most people don't actually, they don't come across biomedically trained physicians. They don't come across the biomedical model. Their experience of health and illness happens in other frames. Right, the world of health and illness is much bigger than they think. Okay, so they thought that was the third important takeaway from studying the history of health and disease. Okay, now the other question, that's my answer to the question, what's the benefit to our students of the collaboration? On the other question, it's what's the ideal collaboration between humanists and global health practitioners? I don't actually know the answer to that. Our global health presence at WashU is about this big. Maybe it's good for us to get in on the ground. We just started a global health program there within the last 5 years. So here's the scientist in me coming out. I think this is an opportunity for the humanities folks in the room to do some data gathering. Those of you who are working in global health, what do you want out of us? What could we do that's useful? Have I said anything today that resonates with you? It would actually be very useful for me to hear what is it that's going on there. And then for the humanities folks in the room, and maybe the global health people have some ideas about this, I think it's worth asking the counter question, which we don't ask often enough, and that's what's the payoff for us? And I don't mean about being relevant, right? Making a difference in the world. What's the payoff to us for the intellectual agenda of the humanities of engaging with global health? I think this really, my traffic thing, right? The traffic really has to be a two-way street. Okay, thank you.
Produced by Duke University. Online at duke.edu.